Yeah, I'm on live. Hello. Sorry, I set up a live and apparently I set up the stream incorrectly. So if you're seeing this now, what I'm going to do is I'm just basically going to answer questions on, try to do this weekly on a weekend basis. We get a lot of questions and comments. I'm sorry, I'm insanely busy at work. Um, and it just makes it very difficult to answer some of these questions. So over the years, obviously, I started this channel to basically help a lot of people with similar questions that I see at consultations, answer um, a lot of questions in regards to issues that people have been having, and just seeking second opinions. I started to notice common questions, so just wanted to help people out and just avoid frustrations that even people leaving a lot of comments right now, seem to be facing and having questions about. So today I am out in Colorado. One of our amazing patients lets us borrow her summer home, so we are out here in Steamboat Springs. So we are extremely grateful that we have awesome patients. That not that we don't have awesome patients that don't let us borrow their summer homes, but yeah, it's just extremely beautiful out here. I don't know if you guys can see, but we're like at the top of the hill, and yeah, it's really hard to see out there. But not only do we have an amazing view, but an amazing house to kind of hang out with our family and friends for a week. So we are extremely grateful to her and her family for letting us borrow her place. Anyways, hi, do you know anything about stem cell dental implants? So, in regards to stem cells for um, implanting stem cells into your mouth, I mean, they've been doing. I remember before I even went into dental school, back in 2004. Like, I remember reading in one of the journals, like in 2003, they were talking about stem cells and implanting them one day, and obviously being a periodontist. The possibility and like what the future could hold. But I mean, realistically, here we are 20 years later, and I don't see that happening for like at least another 10 years or something like that. I don't know. The speed of science is pretty amazing now, but I just don't really see anything like that happening in the next few years. What is your advice for someone who suffers from the problem of tooth sensitivity? So, depends on what type of sensitivity you're having. Some people may just have teeth that are like thinner enamel, and their teeth are just sensitive. Sensitivity can come from, obviously cold sensitivity if you're biting into like ice cream or something like that. Some people just have weaker teeth, so we see some of that. Some people also can get sensitivity because they experience gum recession. And so, but the thing is, there's also people that have gum recession that don't have any sensitivity at all. So if you have gum recession and sensitivity, a great fix would be to be able to do a gum graft. Another option, which I wouldn't recommend, is doing like the composite fillings bonding over your root surfaces. I see some dentists do that sometimes, but I think that just further complicates matters. I think obviously the best way to treat recession, what that's causing the sensitivity, would be some sort of gum grafting. So I'm not too familiar with this whole YouTube live thing. So I was also going to say that if we didn't have enough people joining, that I would answer a lot of my questions that I get. We get a ton of comments and questions every day. I just don't have time to answer these. So let's look at our latest comments. Let's see here. Somebody asked me from last time, I just had my snap indentures put in yesterday. My gums are sore. Can I use a saltwater rinse? If so, do you recommend removing the dentures before I use the rinse? If I can't use salt water, what do you recommend to help with soreness of the gums? Can I use an alcohol-free mouthwash? What method of cleaning do you recommend when I awake in the morning and when I retire at night? Okay, so just with this doesn't have to be necessarily with just snap indentures, but if you're having any sort of surgery done, we always do recommend like saltwater rinses. It really does help you to heal quicker and also to reduce some of that bacterial load. Some dentists will tell you that after they do your extractions and they put in something called an immediate denture, they'll tell you not to remove that for about 24 or however many hours that each dentist tells you. The reason being is that after any surgical procedure, you can have some swelling, and that swelling can then impact being able to like take your denture and put it back on. You might not be able to put it back on. So some people will tell you to keep it off. I mean, keep it on. Really depends on if you want to rinse with salt water. I guess you could try. That's like a personal basis. Just know that you might not be able to put it back on after all that swelling. So I personally would tell you to take it off and do some rinsing again if you can get it off nice and easy. All right, there's another question. Hi, Dr. Choya. Is 25-year-old too young for dental implants? What happens after an implant wears out after, say, 20 years? I've seen, no, 25 years is not too young for dental implants. I would say too young for dental implants. For dental implant timing, you definitely want to watch out with your front teeth. If you're like a teenager, especially girls, back in the day, we used to say that once you cleared puberty, and they would like take x-rays of your, hands, look at your growth plates and all that stuff. But what we've realized is that you don't want to just place dental implants even after you just reach a certain age. Everybody develops differently. But we also realized that your head and your jaws were like the things that like just kept on growing later on in life. And so whenever you see continual growth, that can affect your dental implants. So what that basically means is that you want to hold out as long as possible if you're getting a front tooth dental implant. Now, this gets very subjective. A lot of dentists still debate that. I've been to a conference, a periodontal conference, like our Academy of Perio conference, like a few years ago, and this guy was debating about like, what age is the right age. And some people were just saying like, hold out as long as possible. But then at the same time, what are you gonna do? You're gonna wear a flipper and or a Maryland bridge or something like that, just because you're worried about how many years, I mean, like that you just, how many years your jaw is gonna continue to grow. So if it was my kids, I would probably, I mean, if we're talking about a front tooth dental implant, I would say if it's my daughter, I'd say like maybe 18 years old, son, maybe like 19, 20 for a front tooth implant. Back tooth, it doesn't really matter that much. So I'd say like once I reach like 18, that would be an old enough age to get dental implants. But I also want to make another comment in regards to like wearing out after 20 years. Dental implants don't really wear out. So it's a piece of it's a titanium screw that integrates with your body. So it's very important that if you want a dental implant to last as long as you can, that's always the objective, right? I mean, we got some young patients doing dental implants. We're not looking to just give them a solution for, 5, 10 years. We're looking to give them a solution, that they can take to the grave with them, hopefully decades and decades later. And not only that, but just to make sure that they don't have any complications. Like, I mean, with dental implants, you can, if not properly done, and also just because the way that some bodies heal, and also if you're predisposed to certain autoimmune or diabetes or smoker, certain external factors, but you want to do certain things you can to make sure that your dental implant isn't going to have um, any sort of complications, bone loss, aesthetic complications, especially if they're front tooth. And I made some videos regarding dental implants. I made some of these videos and I released them about a month ago. I'd recommend you look at my channel and look at the last 4 videos that I made, kind of talking about dental implants 101. I really think that information is going to be helpful for you to, be very informed as a patient or a consumer to make sure that you're getting the right dental implant treatment done. I think that if you know a lot of that stuff and you can ask the right questions, then you'll be able to help screen out and find a good surgeon to be able to place your dental implants. Because I mean, who wants to invest a lot of money and have issues with them in the future? Let's see. Hi, doc. If you wear Invisalign, is it possible wearing them can cause recession of your gums? Hate to tell you this, but 100%. I'm not saying 100% chance that it's going to happen, but I say that it's very possible. Invisalign is a lot of tipping movements versus, just how when we're straightening out your teeth or trying to pull your teeth in, like we're doing a lot of like what they call tipping movements. And I have seen a lot of patients that have had Invisalign done and they experience recession and bone loss after it. So the best thing to my recommendation in regards to when you're getting Invisalign done, just make sure that you get evaluated. If you do have people who tend to have recession are people who have thin bone and gums. It's what we call in perio, we call it like a thin biotype. Some people have thick bone and gums, and they just, it's awesome because they're very less likely to experience bone and gum loss from something like Invisalign. But if you or ortho even, but if you have thin bone and gums, then you are going to be more predisposed to having recession with Invisalign or orthodontic treatment. So you want to make sure you go to an orthodontist and have them do a quick look. We work with a great orthodontist in Plano. His name is Dr. Gupta, down in Plano, right next to our Plano office, and he does a really good job of screening his patients, making sure that they don't have active periodontal disease or like recession or excessively thin tissues. He'll definitely make sure that he refers out to a periodontist, sometimes others, some other times too, but just he'll look for to make sure that you're not predisposed to some of those factors, and he'll get a second opinion from a periodontist before proceeding with ortho treatment. And I'm not saying you have to go to him, but I'm just saying in general, like, there are some orthodontists that are more vigilant about that, and that's what you want. And I've also seen cases where people will initiate orthodontic treatment or Invisalign with active periodontal disease, and they weren't screened before, and then they're going through treatment and the patient's teeth are getting loose, and the patient's wondering, hey, what the heck is going on? And then the patient is being told by another dentist or a periodontist that they're going to lose their teeth. So nothing worse than going out and planning to straighten out your teeth and then you lose your teeth, right? And the other thing that you got to understand about, recession or periodontal disease treatment, as with anything in life, getting prevention is a hell of a lot easier to treat and maintain and save your teeth versus um, trying to fix something that's already badly damaged. So, we can bone graft, but it's like bone grafting isn't necessarily given, and it's not very easy and predictable like all the time. There are certain factors that can make bone grafting possible and other factors that don't make it possible. And also bone grafting and some of these procedures can be expensive. So again, preventative procedures are always going to be less costly to your wallet than trying to fix something. So, you know, um, people that are watching channels like this are obviously, kind of like me too. Like I want to just be really informed and know everything I can about a topic because, you want to avoid problems. You want the best results. And also obviously you want to like save some money. So that's obviously been the whole goal with like my channel. But um, even when you try to educate yourself as much as possible, it does become difficult because how are you going to interpret your x-rays? How are you going to like know your probing depths? It's not like, you know, um, it just becomes very difficult, right? So just making sure that you find a orthodontist in this case, dentist, whatever you're going to in these types of procedures, making sure that they're very vigilant and looking out for your best interests and making sure that you're not going to experience other issues while you're trying to straighten out your teeth. Let's see. If you don't have teeth in the back and only anteriors, how would you deprogram a patient with edge-to-edge occlusion? That's a great question. That's probably a question that you should ask a prosthodontist about. I'll watch them all. Let's see. I got mini implants on February 14th and trenches carved out and dentures to sit on top until healed. Despite temp carve out, dentures don't fit, swelling and got sores. Is this normal and how long to heal? Yeah. So, um, personally, I do not like mini implants, and I've made a few videos talking about that. I've seen just a lot of patients have very, very subpar results with their mini implants. And I'm not going to go into detail about that, but I think that just to get to the point in regards to like dentures don't fit, swelling, got sores. I mean, that's very normal early on. And so what you're in right now is an immediate denture. So immediate dentures really aren't meant to be that I mean, it's really like a guesstimate of what it's going to be like on your jaw. So I give people this example, like if you were to have your arm amputated for whatever reason, but obviously you would want to make sure that the person who's going to make your fake arm, your prosthesis, they would wait till you're healed and then get measurements of your arm, the attachment, what's remaining of your arm to detach the prosthetic limb. Um, it would be very difficult for a person to be like, make a perfect prosthetic limb if they don't even know where the physician would have to amputate the arm exactly, right? So, um, but the problem is that when we're doing dentistry, patients aren't going to be cool typically with, having a procedure done, getting teeth taken out and being like, hey, so just don't smile for 2 weeks or wear a mask because you're not going to have teeth for a few weeks or a few months. Like, so patients are always like, no, I got to have teeth the next day. Right. So very understandable. But whenever we are in the process of trying to make a set of teeth for you, and where your jaw is going to look like after your teeth are gone, and we have to smooth out the bone and all that stuff, it's very difficult to kind of guesstimate that. So that's why there's a high chance that your immediate denture isn't going to fit that well. So that also, when it's loose, and how it's fitting your gums, that because it's a rough guesstimate, it's not that comfortable of a denture. Plus, you did also have a surgery done. So those are certain factors which can affect why you're not having a properly well made. I mean, like, why it's the denture's giving you some issues. But saying that, the other side of that coin too is that there are some dental labs that make dentures that make great fitting immediate dentures, and then there's other labs that make immediate dentures where they just literally slop a piece of plastic and it's like inside your mouth, and I'm literally looking at this thing like, was this made for this patient or did they give us the wrong one? So really, who your dentist works with, in regards to making that denture with whatever lab. Some labs are really cheap and make some really cheap dentures. And then some other dentists may charge you more, but then they may use a really good lab and give you a better product. So I hate to tell you this, but like as with many other things in life, you get what you pay for. So, but that can answer a lot of your questions. But also in the future, just to let you know, your bone and gum are going to remodel a lot. So they're going to change shape significantly. So your ability to wear that immediate denture is most not likely. So the best thing is to always get another custom made denture made about 4 to 6 months later after your bone and gum have shrunk significantly, and that'll give you a much better fitting denture. So, Amanda, I did see your questions before. I did answer that. Trigeminal, I mean, I think it's still very soon after your procedure. So, nerve pain, also, like basically in regards to, potential nerve damage or paresthesia after wisdom teeth, like we would have to evaluate um, kind of like where your nerve was in relationship to the wisdom teeth. And that's why we always like inform patients whenever we look at your 3D scans, your CBCT, in proximity of that nerve to the inferior alveolar nerve to your wisdom tooth. And we usually give you a heads up, hey, you might have potential, tingling or numbness after your procedure. Um, my wife, when she got her wisdom teeth removed in Toronto, like I think she said like around in her early 30s, she said she had like paresthesia, like numbness on her lip or chin on one side for about 4 or 5 months before she noticed it went away. And then so it can, be unpredictable, but usually in regards to that nerve pain, I would usually give it a little bit more time. But if you're concerned about it, I would definitely recommend you go in to your surgeon and ask him a little bit more about that. And then if you still feel uneasy about the answer, go in for a second opinion. But it is still pretty early. So, and the body is healing. So, I would just give it the benefit of doubt, given a little bit more time. But, I would, again, go see your surgeon. And then after that, go seek a second opinion if you're not sure. My front upper tooth needs extracting. It's infected, loose, and I'm going for an implant. But my dentist won't bone graft straight away. He wants the infection to clear up, then place the implant and bone graft. Okay. So, wow. So, upper front teeth. I'm going to make a video about this too. Dental anterior. Here within the industry, we call those anterior dental implants, right? So, anterior dental implants are, I tell people placing a dental implant doesn't take a genius to place a dental implant. It's pretty easy. Can you drill a series of screws into the wall? Um, like a series of drills that progressively get larger and larger and drill into a wall. Yeah, like it it's not rocket science, right? But there are some principles that we have to follow to make sure that you don't experience long-term issues with your dental implants. So sorry, one of my assistants just texted me. Um, so there's certain principles that you got to follow. If you again watch my last 4 videos, if you're getting an anterior dental implant, I would highly recommend you go to my channel, watch those 4 videos, and then understand kind of like what's going on. I do see some patients that, and dentistry is very subjective, and I love to give everybody the benefit of the doubt. So if he's doing that protocol, I do see some people follow that protocol where they'll take a heavily infected tooth and then they take it out and they'll do guided bone regeneration, or they'll do a significant bone graft in the future and then place that dental implant. Some people follow that protocol, can have great results. Other people will just take the tooth out, clean out the infection very thoroughly. And that's a huge, huge, huge thing. Like, you have to clean out that infection or you're going to have longer term issues with your dental implant. So when bone is infected, it turns into what they call like granulation tissue. And it literally is like the hard bone becomes very soft and gummy. So it's like you have like pockets of gum inside your bone. That's what it honestly looks like. So you have to go in there, you have to clean it out real well. And then I personally like to bone graft it. And then if we wait that 4 or 5 months and then place your dental implant, and if there's more bone graft that's needed, then we bone graft more at that time. I find it's a little bit like riskier to do the earlier protocol where you just basically degranulate it. It really depends like how infected your tooth is, because sometimes if it's super, super infected, then like that may be the better protocol. But again, everything is very subjective and every case is different. And without looking at the actual, case clinically, like, look inside your mouth and also looking at a 3D scan, that's really kind of hard to determine which course of action we would go. I would, however, tell you that if it's really infected, I would definitely not do an immediate implant, which is when we take the tooth out and then we place the implant. That's putting way too many eggs in one basket when you're doing that with a tooth. Also, what is causing that infection? Is it a root canal infection? Because I cannot tell you how horrible root canal infections can be for dental implants. And they could just be like literally a damn nightmare. And I've been, placing I placed my first anterior dental implant probably like 2009 in residency. And I placed, 10,000 dental implants in my career. I don't know how many of those were anterior dental implants, but anybody who is a periodontist or anybody who it doesn't matter how many he's done, like they'd be lying to you if they told you that anterior dental implants were always predictably like super easy. When we're messing with the anterior dental implant, we're messing with your aesthetics, So if you have a Julie Roberts type of smile and you smile high and we can see your teeth and your gums, then how good that's going to look in the future is really contingent on how your bone is going to heal, because the bone is going to then dictate how your gum heals. And if your gum doesn't look good, then you're going to have an aesthetic nightmare and you're never going to smile again, so because the tooth will just look horrible. So just because of the nature of, obviously with your front tooth, how important it is to get the aesthetics right. Like there's just so many factors that come into play. So, um, you know, yeah, in regard, like that's a tough question to answer without looking at your case specifically in regards to like the best course of action. But here's the beautiful thing about it: if you ever have any doubt, go see another periodontist. And I'm gonna, like, again, I don't want to like, I always try to be very like objective about things and not be like, oh, like we're trying to talk our book or whatever. But I think if you do talk to a lot of dentists, and that if they did need to get a front tooth dental implant, they'll tell you that typically many of them will trust a periodontist more because we get the most training with dental implants in the anterior aesthetic zone. So, you know, but hey, you know what? I've also seen some great general dentists who are awesome. placing dental implants upfront, and can give you very predictable results. Same thing, like I'm sure there's dentists out there that can do amazing root canals and stuff like that. But as a rule of thumb, I'd say for an anterior dental implant, your most predictable route is going to go see a periodontist. So if you have any doubts about your treatment option, go see another periodontist for a second opinion. See, I'm not near you, unfortunately. So what is your opinion on ClearChoice for All-on-4? Hey, you know what? I mean, they're expensive, but I mean, they're an All-on-4 center, and that's all they do, right? And they do have surgical specialists like oral surgeons and prosthodontists at their office. So I know, like, I mean, ClearChoice is a big chain. So I know I have a few friends that actually work at ClearChoice, and I know that they're great doctors. So um, you know, I'm never going to say anything negative about them, but they are expensive. But um, let's see here. Do you think a custom made night guard is worth it, or over the counter guards fine? All right. So I would have said yes, and then I had a patient who has an All-on-4, and she was just grinding the heck out of her like temporaries. So she got an over the counter um like night guard, and she started like I think she went to CVS or something like that. She started experiencing like a lot of like jaw popping. So I told her to like stop using that. But yeah, that was just something that she got out of her own. I mean, like that she got on her own, and her jaw started popping like that. I was like, yeah, that's definitely not normal. So um but I've also seen people that are like using OTC too. Again, I always try to be very objective about things, and they've been fine. So I think it's possible that you try, do at your own risk though, and don't be surprised. Just be very vigilant, see if you're experiencing any sort of jaw issues or anything like that afterwards. Of course, I need general dentists. I mean, we have night guards too at our office. Like, the cool thing is we can even 3D print them nowadays. But, of course, a lot of general dentists will say, hey, this is the reason why. But, there probably is, like, if you talk to maybe some of these guys who are like joint specialists, but they'll tell you exactly why. Like, but that's really not my area of expertise. So, um, okay, so what is the process of you checking to make sure there is a perfect seal on a newly installed crown? I've recently gotten a new crown put on, and I watched a video before to ask the right question. Okay, so typically what we do, this goes back to the day of dental school. We'll use something called a sickle explorer. It's just like a little instrument with a really sharp tip, and we're just going to run it along your tooth, like where your natural tooth meets the crown. And where that margin is, it should feel nice and smooth. So we'll just be, running around the tooth, make sure it's nice and smooth. The other thing we do is after we seat the crown, we want to take an X-ray and make sure that the crown and where the natural tooth meet, that there's not any tiny little opening gaps or anything right there. Because if there is an open gap there, then that means that, bacteria can flow in there and cause an infection. So, well, not necessarily infection, but bacteria can go in there and it's going to start rotting out your tooth, which then it's, because typically when you see that crown on there, it's like super white, right? Because it's a very, what we call radio opaque material. You wouldn't be able to see the tooth rotting underneath there, right? So that's why sometimes, 10 years later, or however many years later that after a person got a crown, and if it had an open margin, then they'll typically tell you a story that they were just chewing bread and their tooth just snapped off. What the heck happened? Well, the tooth was rotting out underneath because there was like an open margin where bacteria was leaking in underneath. But yep, that's typically what you would do. So again, x-rays and running the sickle explorer is what dentists will typically do to make sure that that's going on. See, periodontitis. What is this? Oh, wait, TT. But by the way, my dentist has only done 20 implants. Oh, okay. Again, nothing negative about, and I'm not saying anything negative about the dentist. But if he's only done 20 implants, I mean, it is your front tooth. I'm not, like, don't ever tell him I said that either. But if it's my mouth or if it's my wife's mouth or my kid's mouth, I would go to a periodontist if I were you. Okay, it's the best way to get something, an anterior implant done predictably. Let's see. Oh, periodontal disease caused the infection. Okay, so periodontal disease then also means that you got bone loss then, right? And so those become very tricky implants to treat, right? Because periodontal, like the key thing for long-term longevity of your dental implant and for the aesthetics of your implant, because your bone will dictate your gum levels. So you want to make sure that you don't have uh, too much bone loss because that can really affect your aesthetics. But hey, if you got a really low smile line, like see how I smile, you can't see the top. Well, I guess I could do that. You don't see the top of my gums, but a lot of people as we age, or some people just genetically, they just don't lift their lip line too high. If you're not going to see that, and if you are confident and you would be okay with the fact that even if I pulled my lip back, and then you might see that your tooth is a lot longer than the other tooth, and it's not symmetrical. If you're okay with that, then with your I mean, with having lost that tooth from bone loss and all that stuff, I hate to tell you this, but long story short, it gets very unpredictable. If treating, it doesn't matter like who you're talking to. You could be the most experienced dental implant surgeon in the world. If you have a lot of bone loss from periodontal disease, it's going to be really hard to make it look good. But hopefully, if you have a low smile line, then it's not that big of an issue. I lost bond after an implant became loose. It was inflamed the whole 15 years of having it, but recently fell out. Now it's why I'm losing 9 in that area. It's okay. Not really understanding that question. I've lost bone after an implant became loose. It was inflamed the whole 15 years of having it, but recently fell out. Okay, so if the implant fell out, yeah, that must have been a real big infection. Now it's why am I losing 9 in the area? Is it infection in the bone? I'm not understanding what you're losing in that area. When do you bone graft? How long until you get your implants? I am literally doing another PowerPoint to kind of answer that question. All right. So bone grafting, some people go in as early as 3 months. So when you're doing a bone graft, what you're basically doing is you're taking a tooth out and now you're going to have a hole in your jaw where the root used to be, right? So when you're doing that bone graft, you're basically putting like bone graft is literally like large particles of sand. That's what it looks like. Well, it's not actually sand, it's actually bone. The many different types of bone to use. By the way, I have a video that just exhaustively talks about bone grafting for before dental implants. It's what you need to know about dental implants 101. They're I put these videos out like a month ago. There's a bone grafting video. It's like over 30 minutes long. It's very exhaustive about the topic, anything and everything you need to know about dental implants. So I would highly recommend you look at that video. It'll answer your questions. But you typically wait about 4 months after your bone graft before you place a dental implant. But also it depends on what was the case. Was it a big bad root canal infection? I like to wait 6 or 7 months after that type of bone graft because root canals can be insanely toxic to your bone, and it just takes your bone a long time to heal before you place your dental implants. If you place your dental implants too early after a bone graft, it can potentially cause the dental implant to not integrate very well or experience bone loss. So I would say just wait a little bit longer to get a nice predictable result. All right, let's go back to some more of these comments here. So I answered that. Somebody said, yeah. Sorry, I missed this. I'm going for implants. Oh, okay. So these kind of comments are just kind of all over the place. Some are just positive comments, and some are just asking questions that I'm looking at that are just a little bit more detailed. All right. Well, I'm on vacation right now. My kids are napping, so I think I'm gonna just head back and just relax. We're going home tomorrow. And if you guys don't have any other questions, then I think I'm going to do my next one on next Saturday. I'll try to do it consistently, like on the weekends, so I can help people out with their questions here. So maybe Saturday at like 1 o'clock or something like that, Central Standard Time. That's when the kids are typically napping. So I will then set out basically these little live sessions, and I guess you guys, I don't know how this really goes. You guys can subscribe to that. So hopefully you guys, this was information was very helpful. Again, if you guys have any questions in regards to like my videos I've been trying to hit lately are more dental implant related. So stay tuned, watch the last few videos that I created. I'm trying to make exhaustive videos about everything about the dental implant process that I think is going to be very helpful for you guys to understand if you guys are going through that process. Um, Taking new patients, I'll be moving back to the area soon. Oh yeah, we're always taking new patients. Extremely busy right now, but yes, we've been adding. We have Dr. Wynn. He's our general dentist. He's amazing. He's also does surgeries. He's also great at dental implants and wisdom teeth extractions. We also have Dr. Wooldridge. He's our prosthodontist. We're also adding on another prosthodontist here very soon. We also did add Dr. Obando, who's another periodontist. He's starting pretty soon, and also we may be adding another periodontist who has a ton of experience with all-on-4 surgeries. We are doing so many all-on-4s at our office. It is killing me because literally it's like, it's just when you're sitting in these 3-hour surgeries all day every day, it gets to be pretty exhaustive. But yep, so we do have a lot of great doctors, and they do great work. Let's see here. Periodontal disease, severe bone loss. How does this affect getting dental implants? Good question. So, all right, I'm just going to answer a few more questions. I'm going to go. So never get dental implants if you have active periodontal disease, severe periodontal disease. So if you have very deep pockets and you have periodontal disease and you want to just get like a dental implant or something like that, then the thing that we're worried about is that the bacteria will still go after the bone. And if it's going after the bone, then it can cause your implant to experience bone loss and become infected, and you'll lose those dental implants. Now, a caveat to that is something like snap-on dentures or all-on, or if you're taking out all your teeth, well, that bacteria is on your root surfaces. So what you want to do is you want to make sure that you're going to get all your teeth taken out. And so you could still get dental implants in that case, right? So just make sure that if you have existing teeth and you have active periodontal disease, then make sure you get your periodontal disease treatment, however bad it may be. If it's minor periodontal disease, so mild, generalized mild periodontal disease, then basically you could just do like deep cleanings, and then they want to make sure that your pockets are okay after that. If it's more moderate to severe and maybe you need periodontal disease treatment such as osseous surgery or LANAP, which is the laser gum surgery, then if you need that, then you want to make sure that you get that taken care of and get rid of that bacteria, and then you can get your dental implants. So hopefully that's helpful. I go for my 3D scan and consult at my local dentist. I fear they do not do enough grafting. I get dentures the March 3rd, 23rd, the same time. Could I get a consult from my office if I provide my 3D scan? Yeah, sure. Email us at contact@northtexasdentalsurgery.com. Man, we're like, I don't even know how far we're booked out for these consults, these virtual consults, but we do get booked out for a while. So give them a call and see what they have to say. We do usually, go over your scan, and we'll help people out. Let's see. Can I request you? Of course. Yeah. So do you have a recommendation of a pediatric dentist in the DFW area? That's a good question. Not off the top of my head right now. So as a periodontist, I do see a lot of older people, and obviously we do a lot of wisdom teeth. I do see a lot of people in their teen years and above. Let me do a little digging for that, and I'm sure I can find you a good one. Let's see. So I have a wisdom tooth that is horizontally impacted, and so let's see, can they shave down, because it's right next to the second molar? Can you shave down the wisdom tooth instead of extracting it? They said it might be next to an important nerve. If we shave down a tooth just like that and remove some enamel and get into your dentin, then your tooth would be insanely sensitive and you would be in agony, and you would You wouldn't like that. So what we typically do, if that's the case, even if it's close, did they do a 3D scan? Even if it's close, you could typically 99% of the time remove it safely. Now, sometimes the nerves are like literally wrapped around the nerve. I mean, I probably see it like, a handful of times each year, and we probably see like 5 to 7 wisdom teeth consults like per day. So we do tons of wisdom teeth, and I see a lot of patients at the office. But just to give you kind of like a sense of how common that is, it's really uncommon. So again, like I said, I see it 5 or less times a year in regards to like when that root is actually like developed and wrapped around the nerve. So all I'm saying is that, get a good CBCT, see a specialist, and make sure that they take a look at it, interpret it for you, and tells you like what your risk is for getting those wisdom teeth removed. So, and then God forbid it is, and that tooth is bothering you. And then that's another thing. Like, do you really need to get that wisdom teeth removed? That's contingent on how old you are, you know, even race, so like sometimes like, the older you are and certain races have more dense bone. And I tell people is it easier to pull a hook out of drywall or is it easier to pull it out of concrete? I mean, if we're pulling out of concrete, we're doing a lot of drilling. The more drilling it is, the more invasive the procedure, the tougher recovery, the higher morbidity, just pain and, just the procedure sucking. So, like there's certain factors, like all these things that come into play. Whenever I see patients, I literally tell them like, hey, here's all the risk factors. Here's the pros and cons of removing your wisdom teeth. You know, a lot of teenagers, I'd say like 99% of teenagers, like even with my kids, when my kids are like probably 15, 16, I'm going to be looking at their scans. I'm going to see what it looks like and, when the right age is to remove it. But I'm definitely going to remove their wisdom teeth when they're teenagers. I don't care if they've never bothering them. And I understand many people will say, well, my grandparents or my parents never had their wisdom teeth removed or whatever. It's like, and I totally get that, but um, we do see a lot of patients in their 20s to 80s, so 2 months ago, I removed a wisdom tooth on like a 83-year-old or whatever it was. The guy had like a super infected wisdom tooth and it was horizontally impacted just like yourself. So we do see cases like that. So, but anyways, kind of going back to the point, every case, once you've probably like gotten into your 20s, is a case by case basis where um, I don't think you indiscriminately always remove wisdom teeth, but you have to look at the pros and cons. And the cons may be potential complications with nerve proximity and how deep that tooth is embedded in your bone and just many different factors that come into play. And then we always tell patients like, hey, this is, again, your decision to make. I'll give you all the pros and cons. You make the final decision. I want you to feel comfortable about what you're about to do. Okay, and you're 34. Is that a hook removing? Yeah. Is that a hook removing from concrete? Yes. Yeah. Um, I have my appointments from Monday to Thursday next week. How far is your Plano to your McKinney office? It's like 25 minutes. Yeah. Okay. All right. So next session I'm gonna do, yes, you're welcome. Hopefully this is helpful. I got 16 viewers right now. I'm feeling really special right now. But yeah, again, the whole goal of this is just to help people out. Hey guys, follow me on Instagram, follow me on Facebook. Stay tuned. We are going to give out a free all-on-4 to someone who's well deserving. And by that, I mean somebody who's just a good person and may have hit hard times. And if that's not you and you know somebody and you would like to nominate somebody, we are looking, again, going back to, I feel that North Texas Dental Surgery and why I started the practice is I feel like I am extremely blessed and I have a lot of gratitude for my life and having a great team, a beautiful family, and a great practice. And so we just want to help other people out too. But stay tuned, follow us on Instagram, Facebook, YouTube, and a little bit more details here in the future. We will be doing this pretty soon. So, I mean, like starting this, it's not just going to be one case. We're going to um, help several people out. I don't know if it's going to be bi-monthly or whatever it's going to be, but yep, just stay tuned. All right, so hopefully this information was helpful. One last question. I have a 4-year-old, 15 implant, number 15, a 14-year-old, like 15 implant molar has become sensitive to blood pressure. Could this be a nerve issue with the tooth or in that area? Thank you for your channel. Zygo implants. What about Zygo implants? Anyways, so yeah, hopefully this information was helpful, and I'll do this again next Saturday, probably around 1 o'clock Central Standard Time, and just be ready for that. And also, I will put a little link on there pretty soon. All right, hope you guys have a great weekend. Thank you.